I'm Dr. Parwan Malikzadeh.
And I'm Dr. Parisa Malikzadeh.
And we are
Sisters RX.
Thank you for joining. Today we'll be discussing
Hemorrhoids.
Okay, so what are hemorrhoids?
So hemorrhoids are swelling of the blood vessels that are located in your rectum. And your rectum is the end or the last part of your colon. And you can have swelling or hemorrhoids that happen on the inside, also known as internal hemorrhoids, or you can have swelling on the outside that's also known as external hemorrhoids. Sometimes you can even have a combination of both internal and external hemorrhoids.
Oof, okay, so why do people get these? What are some risk factors?
So the risk factors include anything that increases pressure in your pelvis. So for example, if you are constipated and are straining to go to the bathroom, that increases your risk.
Okay.
Anybody who has a very sedentary lifestyle or is sitting for a long period of time can increase your risk. Obesity, that just puts a lot of pressure in your pelvis. Being pregnant is also a risk factor.
And so many patients that are pregnant will have these complaints, so this is very common.
Exactly. Some patients who are taking blood thinning medications, also known as anticoagulation, can be at risk of developing hemorrhoids.
Wow, that's so interesting. Okay. How do I know if I have a hemorrhoid? What are some symptoms?
Yeah, so some of the common symptoms include a swelling down below, especially after you go to the bathroom and are straining.
Okay.
Other symptoms can include anal itching or irritation, and then bleeding can also happen. The bleeding is generally described as having spotting right after you have a bowel movement, and you typically will wipe and see, oh, there's spotting there.
Okay.
Yeah, so I always tell anybody, even including my friends, if you're having bleeding per rectum, so down below, and also your bowel habits have recently changed, you need to talk to your provider. You may need a colonoscopy, as some of these symptoms can be associated with an underlying cancer.
Wow. Okay, that's good to know.
Yeah.
Thank you.
But outside of that, in general, your provider will start with a physical exam where they'll examine down below. So be prepared for that.
Okay.
They'll look on the outside, and then sometimes they may use their finger to feel and make sure there's no mass or any abnormal things down below. If you're seeing a specialist like myself, a general surgeon or a colorectal surgeon, be prepared for a anoscopy.
Oh, what's that?
So it's essentially using a smaller speculum to look inside and try to figure out if there is a mass or not.
That seems reasonable. So then what are some of the treatments for hemorrhoids?
Yeah, so the first step in treating hemorrhoids is to address the underlying problem, which is increased pelvic pressure. Okay. So we start with lifestyle modification. First, we say you have to stay hydrated, so you drink lots of water. Limit alcohol and fatty food intake is also another recommendation. And then just increase your fiber intake.
Okay, I hear this all the time, increase your fiber intake. What does that mean?
So in general, you want a 25 grams to 35 grams total fiber. Okay. But it's hard to like sit there and look at the vegetables and try to figure out. So I just tell patients you need to increase foods that have lots of fiber in your diet 3 times a day. So some of the common fiber that I recommend is apples, bananas, wheat, some beans. They're very high in fibers. And like anything that looks green is very high in fiber.
Okay.
If you do that and you're still having a hard time going to the bathroom, I do recommend taking over-the-counter fiber supplements. Usually, again, I start with 35 grams. The recommendation is 25 to 35. But in general, my patients are symptomatic, and I really want them to just control the symptoms and address the fiber quickly. Sure. But the other option is to also include laxatives, so over-the-counter medications that help you go to the bathroom.
That makes sense. And then for patients who do have a higher weight and that's contributing to that pressure, it's always good for everybody, but especially those patients to exercise. Is that fair?
Yeah, and even people that do exercise, I say increase your activity. If you're overweight, we can also help with medications. You know, now there's shots, things to help you lose weight.
GLP-1s, yeah, it's all over. Okay.
In pregnancy, we just do mostly symptomatic care, and the reason that is because in general it goes away after the baby is born, as you can imagine.
Correct. That's correct. So definitely things like abdominal binders, physical therapy, all those things can help with alleviating some of the pressures down below.
Exactly.
Okay, so besides improving my diet, exercising, is there anything else I can do to decrease my chances of hemorrhoids?
Yeah, so I think one of the things is when you're in the bathroom, I recommend to my patients not to take their cell phone or a book. You shouldn't be sitting there like You have to,
Interesting.
so you have to concentrate on going to the bathroom
Okay.
and to minimize the straining.
Okay.
I also say increase your water intake and then increase your physical activity.
Okay. So with the water intake, I know typically depending on your height and your weight, how much hydration you're getting varies. But in general, do you have a ballpark on what you tell patients?
I just tell patients drink until you're going to the bathroom and your basically your pee is clearish, okay? Because if it's
Okay.
really concentrated, you're probably dehydrated.
That makes sense.
Yes, I think that's easier to explain than to be like take 4 liters of water or 3 or things like that.
Sure. And then now I know there's jugs all over where you can, it says the measurements on it, so you can try to, make a fun habit and see how many times you can fill that up in a day. So yeah, you can kind of get playful with it, I guess. Okay.
Yeah.
Okay, that's really helpful. But I've also heard of like sitz baths. Can you tell me a little bit about that?
So sitz bath is essentially applying warm water to the area to relieve your symptoms.
Okay.
And the recommendation is to place water there for about 5 to 10 minutes a day, up to 3 times a day.
Oh, okay.
And the way you can apply water is to simply fill up your bathtub up to your hips in warm water and just sit there. Or there are special containers that you can buy over the counter. You fill it with water and then you use that.
So, should I fill it with soap or should I fill it with salt?
The recommendation is to not do that because that can further exacerbate your symptoms.
Okay.
So we just say warm water, best way to go.
Okay, that makes sense. Say I try all these things and I'm not finding relief. When should I see a specialist?
So in general, after the lifestyle modification, if you're still having lots of symptoms, if you're not straining and you've addressed the constipation, you'll see the specialist. And at that time, they can talk about, in-office procedures or a surgical intervention where we remove the hemorrhoids. I'll talk about that in a different video.
Okay. What is the take-home message? What do I need to know?
Yeah, so hemorrhoids can be common. Often they're actually not symptomatic. When they do become symptomatic, we try to address the underlying issue, the constipation, the increased pelvic pressure. And in general, we start with lifestyle modification. Typically, that helps address the issue. Rarely do you need surgery.
Great. Thank you so much. That was really helpful.
Thanks for joining us for another episode of Sisters RX,
where we prescribe clarity in a world of medical noise.
Until next time,
cheers.